Good morning. This April 29th meeting of Senate Finance Committee will come to order. I'm going to start with a couple of announcements. First of which is for committee members, Ms. Stengel's updated memo on what actions have been taken on the finance bills the last week or so is in the packets. And we're planning to meet, Finance Committee will be meeting
Check one, check two.
We are back. We'll continue where we left off before the power outage. Finance Committee, as I was beginning to mention, will meet until 10 a.m. And if we're able to get through the agenda, we will adjourn. Otherwise, we'll recess and return after the end of session. I want to thank advocates who may be here for the Human Services portion of the agenda. We do not know if we'll get to that bill before recessing at 10. I do hope we can, but we don't know how far we'll get on that. And with that, we're going to start out with Senate File 4067, Senator Mohamed, which is the Omnibus Judicial Supplemental Appropriations Bill. And this is going to be the vehicle for the gun violence prevention package that was discussed yesterday. And before we begin, Ms. Stengel will walk us through the planned actions for the bill.
Thank you, Mr. Chair. As you just mentioned, Senate File 4067 will be before the committee. There will be two amendments that are both in your packets. There's first the A7. This is a DE amendment, which includes the works to some appropriations, which Senator Mohamed and or Mr. Turner will walk through. After that, there'll be an opportunity for additional amendments, debate, and discussion, followed by a motion for consideration to pass the bill out of committee.
Thank you. And with that, Senator Mohamed will move the we have in front of us Senate File 4067. Senator Mohamed will move the A7 amendment to incorporate the language we adopted yesterday into that. Is there discussion on this? If not, we'll take this on and then take up the other amendment, and then we'll go through the walkthrough, if that's okay, Mr. Turner?
Sure, that's fine.
Okay. With that, any further discussion on the A7? If not, all those in favor say aye.
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 Opposed? Motion prevails. Now, Mr. Turner, the A8 amendment has some number of changes.
Yes, Mr. Chairman and members, if you look at the A8, it updates the DOC and BCA appropriations to reflect the latest fiscal note, the 2A revised, which is in your packet. The DOC bed costs are dropped due to the penalty revisions in the A19 amendment adopted yesterday, which is now the A7 amendment of Senate File 4067. And the cost of the BCA administration of the certificate of ownership provisions went up slightly from $450,000 in fiscal year 27 to $484,000, with tails of $165,000 each year. Those are the only two changes to the spreadsheet. If you'll see on spreadsheet dated 4/28/26, 4:22 p.m., the DOC provision is dropped completely. The Department of Public Safety, the first line, line 3, BCA SAMHSA ban certificate of ownership contractors with BCA ongoing costs. That $484,000 reflects the new language. Other than that, the rest of the spreadsheet is identical to yesterday.
Is there a discussion? If not, Senator Mohamed moves the A8 amendment to update the numbers to match the updated fiscal note. No further discussion. All those in favor say aye.
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 Opposed? Motion prevails. On the Senate File 4067 as amended, Senator Mohamed, you went through the bill yesterday, but if you want to make any additional comments, and then we'll have.
Thank you, Mr. Chair. This is giving members more opportunity to look through the bill. Happy to take questions on the bill.
Is there questions or discussion or comments from members of the committee? Senator Pratt.
Mr. Chair, thank you. I just wanted to thank nonpartisan staff for, doing good work on getting these fiscal notes. I know we had quite a discussion on that yesterday, and appreciate their diligence in pulling it together.
And yes, all the fiscal notes are in the packet, except, there's certain sections that have no fiscal impact and others that have simple appropriations, but the fiscal notes are all in the packets. Is there further discussion on Senate File 4067 as amended? If not, all those in favor say aye.
Aye.
Opposed?
Aye.
Motion prevails. And with that, Senate File 4067 is on its way to the floor. Thank you, Mr. Turner, Mr. Bacchus, and Sir Mohamed. Appreciate your work. The next bill we are taking up is Senate File 2689, Senator Johnson Stewart. And while she's coming up to the table, Ms. Stengel can walk us through the planned actions for this bill.
Thank you, Mr. Chair. The plan for this bill is to take up Senate File 2689, which is the underlying bill. Senator Johnson Stewart can give a presentation of the bill, and then the bill will be laid over. Following that, we'll take up Senate File, or House File 2344, which is the supplemental budget vehicle. At that point, there will be an amendment to put the contents of Senate File 2689 into that vehicle, followed by any additional amendments, debate, and further consideration. And then following all of that, the bill will be laid over as amended.
And members, the bill is being distributed to everybody right now, and we will wait for that, and then we'll resume in a minute.
Oh, Carolyn, I got one.
Senator Johnson Stewart, welcome to the committee. Members now have the bill in front of us, and please go ahead and explain the bill.
Thank you, Mr. Chair and members. Good morning. I'm here to present Senate File 2689, the MAP Act, or Medical Assistant Protection Act. This is bipartisan legislation that will expand the Attorney General Office's ability to investigate fraud in Minnesota's medical assistance program. Excuse me. It will give the office new tools to hold fraudsters accountable and increase penalties for those found guilty of stealing money meant for low-income Minnesotans' health care. We've had significant engagement and discussion through both committee process and with our members and stakeholders. The current engrossment increases funding for both staffing and administrative costs. The latter was just added in our previous stop in Human Services. The new funding and new proposal includes staffing at the recommendation of the federal government to include 11 investigators, 3 attorneys, and 4 support staff to the unit. So if passed, this bill will increase the MFUCU, or Medicaid Fraud Control Unit, staff from 32 to 50. It also expands the AGO's subpoena powers to reflect the same authority as that held by county attorneys. There was an amendment in judiciary that limits those subpoena parties to, that limits those subpoena powers to documents related to Medicaid, and I want to remind you all that that was a bipartisan amendment that was accepted. Amended language also includes something called an intent to defraud. This will help ensure that providers who make honest mistakes aren't needlessly criminalized. And we have also, in our final engrossment, incorporated feedback from the Minnesota Sentencing Guideline. I'm a little bit clunky today. We also incorporated feedback from Minnesota Sentencing Guidelines Commission to incorporate an intermediate penalty at their recommendation as well. So this bill has seen many committees. It has been amended. I feel like it's in really good shape right now. I do have Nick Wonka, who is the head of the Medicaid Fraud Control Unit, here to testify. I believe Attorney General Ellison will be here if any questions are need his response. But with that, Mr. Chair, I offer Senate File 2689.
Senator Johnson Stewart, thank you. Is Mr. Nauman want to go through the fiscal note?
Mr. Chair and members, I can do that. It's in your packet. It's the fiscal note right behind the bill itself. So the short, quick-hand version for members is that the Attorney General's office has flagged for some legal attorney work and some legal assistant work, a requirement of $1.231 million beginning in fiscal year 27 with ongoing tails. I should indicate to members that this appropriation was added to the bill as it's already in the base bill as part of the state government articles that were discussed Monday of last week. So I think that appropriation is already in the bill. The Department of Human Services has indicated some documentation work and an increase in documentation requests coming from the I'm not going to say this acronym properly, MFCU, which Medicaid Payment and Provider Services team, to track and redact as appropriate and submit information to the OIG. They have flagged an additional cost of $85,000 in fiscal year 27 and an ongoing price of, excuse me, $100,000 in 28 and later. That appropriation is not provided in the bill, and I think it is the preference of the chair to not include it in the bill itself. So they would be absorbing that cost at the Department of Human Services. So, Mr. Chair, if there are additional questions, we can entertain those, but that's a quick run through on the fiscal note.
Are there questions at this time? Senator Pratt.
Thank you. Thank you, Mr. Chair. And just noticed that in the table on page 5 of the fiscal note, it lists out the cost at $200,250 per attorney, and so on. And what I'm wondering is it says 25% state share. So where's the 75% coming from?
Senator Johnson Stewart.
Thank you, Mr. Chair and Senator Pratt. So with MFUCU, Mr. Nauman, remember I've been carrying this bill for a long time. So with the MFUCU office, or the Medicaid Fraud Control Unit, the federal government provides a 75% match. And because of that match, the attorneys that work on Medicaid fraud investigations are strictly required to only work on Medicaid fraud investigations. So in the many committee visits we've had, or hearings we've had, many senators have asked about bringing attorneys over to backfill or to help to, even out the workload. And if Mr. Wonka comes up and testifies, you will hear him also say that it's forbidden. When the federal money comes in as that 3-to-1 match, then those attorneys are not allowed to work on anything other than Medicaid fraud.
Thank you. We are now going to lay over Senate File 2689. Yes, Senator Trejo.
Chair, I have an amendment, but I think it's drafted to the,
2433.
Yeah,
Yes,
yeah,
we'll take
thank you.
that up in just a minute
Yep.
after we are now laying over Senate File 2689 and taking up House File 24333, which is the Omnibus Supplemental Bill. And to that, what Senator Friends will offer is Senator Johnson Stewart's A54 language, which, if I'm understanding it correctly, has the language from her bill other than the appropriation, which is already in the supplemental finance bill. Is that correct, Mr. Nauman?
Mr. Chair and members, if you make a quick comparison on Senate File 2689 before it was laid over, on page 11, there were appropriations in Section 7 and Section 8. Members will notice that the A54 does not include those appropriations for the reasons that I indicated earlier. The base bill in the state government article includes that appropriation to the Attorney General's office in the amount that was shown in the original bill, and the DHS appropriation is omitted. So, Mr. Chair, a long answer to your question, yes.
Thank you. So, Senator Friends moves A54 amendment, and that is the language, again, other than the appropriations from the other bill. Is there any discussion? If not, all those in favor say aye. Aye. Opposed? Motion prevails. Now, discussion of this, and Senator Draheim, I know you have an amendment you just indicated.
yes, thank you, Chair. I would like to offer the A65, and it should be in the packets, and I tried to share it as soon as it was drafted last night.
Senator Draheim offers the A65 amendment, which is in the packet. Everybody, you want to go explain the amendment?
Yep, thank you, Chair. Pretty straightforward, and those of you who have served on committees with me, this is something I normally do. I'd like to hear what we're spending money on, and I think we all support the concept of this. It'd be nice to get a recap on the success of the work the Attorney General's office is doing, so this would just require a report, and if requested to come and give testimony on that report annually.
Senator Johnson Stewart.
Thank you, Mr. Chair, and thank you, Senator Draheim. I do appreciate very much that you shared this with us yesterday, early enough that I could talk to the Attorney General's office about it. I do understand the principle behind the amendment, and I agree that it's important that we have accountability. I do have to say that with the last year and a half working with the Attorney General and learning more about the Medicaid fraud unit, I've been really impressed by their effectiveness. You all have a handout that looks like this. Page 3 talks about the fact that despite the fact that our Attorney General's Mafuku office is understaffed according to federal oversight, they repeatedly and regularly outpace their peers' offices in recovering Medicaid fraud and in identifying waste and abuse. So this is something I'm really proud of. I'm also concerned about it because this report would have somewhat of an administrative cost. So given that, I would encourage members to vote no on the amendment. And if there's additional questions, I think we do have staff from the Attorney's office, the Attorney General's office, that could answer further questions. But I would ask for a no on the amendment, respectfully.
Further discussion, Senator Draheim.
Thank you, Chair, and I guess that's disappointing, and I think, you know, if we're gonna spend this type of money, that I think the people have a right to know on the success of it, and there should be some accountability back to us, in my opinion, on what we're working on. And, you know, the waste, fraud, and abuse is front and center every week. It's the number one topic in my district, everywhere I go, and this will help. But I think we need to know how effective, what's working, and I think it would help drive us to do better legislation if we know what they're investigating and what programs. I think there's for good reason, there's some gaps in communication between the Attorney General's office and the legislative body. We can't know about ongoing investigation specifics, I get that. But broad strokes we can get. And I think it would make us elected officials better by having this information. So I'm going to support the amendment still and urge the rest of my colleagues to support it. So thank you.
Senator Murphy and then Senator, oh, it was Senator Mohamed, was it? Okay, I'm sorry. So Senator Mohamed and then Senator Murphy, okay. And Senator Pratt, okay.
I'm going first, yes, Mr. Chair?
Go ahead.
Okay, thank you, Senator Pratt, Senator Draham, sorry. Rarely do I get Republican members' names mixed up. I serve on every committee with you, so I've certainly seen this amendment go into a number of our omnibus bills and have supported it in the past. I will say, I think this particular division is one that is currently tackling fraud. Probably the only agency in the state that seem to have had success on the issue. And even when I look at the fiscal note, this might be one of the most thorough fiscal notes I have seen. It even talks about the billing, the hourly billing the attorneys are asking for. And I don't, I think it's important to have reporting on the funding we're going to give it to agencies, and it's one that I support. I think maybe it would be important for the Attorney General's office to talk about how they're tackling the issue on fraud, because this amendment comes from the legislature not knowing whether our agencies are doing their job thoroughly or not, and this would be an opportunity for them to talk about that.
Senator Pratt? Oh,
Thank you. Thank you, Mr. Chair. And, Minnesotans, well, let me take a step back. This amendment puts us in the role that we're supposed to be in. We are the appropriating and the policy body in government. Minnesotans have lost faith in our government due to this fraud. And they've lost faith in our ability as legislators to do appropriate oversight. They expect us now more than ever to be on top of this. They expect us now more than ever to be watching out and to have that second set of independent eyes. They expect us now more than ever to be asking these questions and holding our agencies accountable. Whether it's DHS or whether it's the Attorney General or whether it's DEED or any other agency, we are expected to be holding these folks accountable. And this is a very simple, easy way that has never been a big fiscal cost in any of the other amendments that Senator Draham's put this amendment on. Mr. Chair, this is a very reasonable and responsible amendment for us to take. And I would be very disappointed if we can't agree on that. As the Finance Committee, making sure that we have oversight on the monies that are being spent. And I think the Attorney General should welcome that type of transparency, that he should welcome that when he comes to ask for us for money, that he's going to tell us that he's been a good steward of our taxpayers' funds. So, Mr. Chair, I encourage members to vote yes on the amendment.
Mr. Chair.
Senator Johnson Stewart.
Thank you, Senator Pratt. Senator Draheim, Senator Mohamed, my understanding from all of the conversations I've had with the Attorney General is they're already required to do this report. I think Mr. Wonka is here. I can't really see him, but he is the head of the Medicaid Fraud Control Unit, and if it would be okay, he could speak much more accurately to what their requirements are. So if he's in the room, I would ask him to come up.
Identify yourself and speak to the committee.
Sorry, I got here early and didn't see them.
Okay.
Good morning. I'm Nick Wonka. I'm the director of the Medicaid Fraud Unit. And I can detail some of the reporting that we are already required to do in a quick review of what was requested here, some perhaps gaps and issues with it. So every year, we are required to report to the Federal Department of Health and Human Services Office of Inspector General the information that is already detailed in this report. Our reports to HHS OIG are public. They are posted on the HHS OIG website, as are line items comparing all of the state Medicaid fraud units in the country in their staffing levels, their budget, their charges, their convictions, their civil recoveries, their criminal restitution in a chart. That is something, as those of you who may have heard me testify in other committees, that's where, when I'm talking about we rank at this number in convictions, we rank at this number in recoveries. That's where I'm getting it from, these public reports that are already available. One of the things with this particular reporting mechanism too is it is requesting budget information and accounting information on a calendar year cycle. We operate on a federal fiscal year. And so if you are requesting budgeting and accounting information on a calendar year cycle, you're going to capture two different federal budget cycles with two different types of budget, and you're not going to get the accurate information that you are looking for with the amount of budgetary funds spent in a particular year. So those are just two things here that I wanted to point out with this specific language in this specific amendment, is that it may not capture the information that you want budget-wise, and the rest of the information is already submitted in a public in a report that is public to HHS OIG, and we're required to submit that to them by the end of every November in a calendar year.
Thank you, Mr. Hawk. And Attorney General Ellison, welcome to the committee.
Thank you, Mr. Chairman, and I'd like to thank all members, and I certainly appreciate the spirit of the amendment, but I think it would be unnecessary and duplicative, and the cumulative effect of all the reporting that we do, this simply would not add to anything. We issue not only this federal report, but also a report entitled the 8.15 report. We have numerous reporting requirements, and so it simply is layering on already number of reports without any beneficial effect, because we already do it. So in terms of avoiding duplicative, wasteful, unnecessary reporting, I would think that this additional report would not be necessary. We would be more than happy to make sure this committee gets the reporting that exists now. And then I would also say there's a provision in there that says that I personally and individually must be the person who comes, which I think is an extraordinary requirement. I've never seen it, and I hope that we don't do that.
And Attorney General Ellison, yes, I saw that in there, and we don't normally require a specific person to come here, but we appreciate your coming here today. There are questions for Mr. Walker, the Attorney General. And I do have one, Mr. Walker. You said that those comparisons of AG units around the country in terms of how much is collected, how many cases, and so on. Would you be willing to share a link to those reports with the committee? I'd appreciate that, so we can share it with members of the committee.
Absolutely.
Thank you. Senator Murphy, Senator Draham on the Attorney General. Okay.
Thank you, Chair, and thank you both for coming today. I do appreciate that. And this amendment can be amended. And Attorney General, I know you're very busy, and we could add an oral amendment to put office in there to accommodate someone from your office presenting, and not you specifically. And if the report's already being done, that's perfect. If there's some nomenclature that needs to change on the timing of the difference between a fiscal calendar year and our calendar year, we could add language to it to say the last report. If it's done in November, I'm fine with that. I just feel that we spend a lot of money ramping up new FTEs across all our agencies across the state, and to try to tackle important things. But we never really get the detail on how effective those FTEs are being used. And I think it should be commonplace that we have some kind of feedback every time we make a change or an adjustment of this magnitude. So if I could ask nonpartisan staff to address those two issues that we heard. One was the difference in calendar year or budget years, I should say, between the federal and state budget. And then to make sure and clarify that it isn't the Attorney General, him or herself, coming, but their office to present the report that they're already doing. That would be wonderful. Thank you.
Senator Murphy, or Senator, Ms. Stengel, you want to comment? He had asked you to draft some changes.
Mr. Chair, Senator Draheim, I would suggest that perhaps some language you could consider would be on the A65 amendment on page 1, line 9. After preceding, insert federal fiscal. So it would say money was spent in the preceding federal fiscal year. And on page 1, line 11, after the first "the," insert office of the. So it would say the office of the Attorney General must present this information.
Senator Draheim, I'll suggest you incorporate that into your amendment. Let's have further discussion on the amendment now as he would incorporate in there. And then I have Senator Murphy and Senator Friends, and perhaps Senator Draheim want to talk too.
Thank you, Mr. Chair. I want to begin by thanking Senator Johnson Stewart for her work on this legislation. I know it has been a priority for the Attorney General's office for the last couple of years. That priority heightened in the wake of the emptying of the U.S. Attorney's Office. We all are, in our own ways, working to prevent and combat fraud, and we know part of that is about holding people accountable. And we need a Medicaid fraud unit in the Attorney General's office to do that job. I will also say personally that I can attest to the Attorney General's vigilant engagement on this piece of legislation. And he's been very, very present in the legislature. And I don't expect that that is going to change as we move forward. And I appreciate that presence and that vigilance. I think it impacts and affects how we are thinking about our work and makes sure that we are doing our work properly. The thing that is most important to me in this moment is I appreciate the intention of this amendment. But if we think about the O'Malley report and what it taught us, if we're reading it and taking in what they shared, the legislature has to play an active and vigilant role in oversight going forward. And I worry that doing something like this amendment gives us a chance to check something off and say, okay, we've done it, and we're going to get a report, and it could sit on a shelf. And if we are serious about overcoming and preventing and putting to bed the fraud that we are experiencing here in Minnesota, that's hurting people and people's faith in our government, then the legislature, the next one, that I hope to be a part of, we will seriously do the oversight that we need, including with the Attorney General's office in the State Government Committee, perhaps in the Judiciary Committee, to understand the improvements that are being made by the policies that we put in place. I don't think this amendment is necessary to do that. That is a job and a charge that we need to give ourselves, and we have to embody it in our work. And so I hope those of us that are going to come back, and if we're lucky enough to be elected in this next election, that we take that charge seriously so that we don't ever face this problem again. Thank you.
Senator Friends.
Thank you, Mr. Chair. Thank you, Senator Johnson Stewart. Thank you, Attorney General. Senator Draheim, I'm with you on these amendments in general, that we want reporting, and I'm with you that we have to have some way for the agencies to get back to us what happened. I have generally been a yes vote on these amendments, as you know. As I understand the concern of the chief author in the AG's office, this is redundant. And so I wonder, Senator Draheim, if an alternative to the A65, which I would have to vote no on as best I understand it now, would be some commitment between you and Senator Johnson Stewart that you must be satisfied that the reporting that they're talking about is adequate to meet the need. And for that reason, I'm just suggesting, Mr. Chair and Senator Draheim, and I mean this as a compliment, Senator Draheim, you have earned a ton of credibility on the Finance Committee with reporting issues. I have the funny feeling Senator Johnson Stewart will be listening carefully to your concerns. But if it is true that it's redundant, if it's true that it's unnecessary, and she can satisfy you that that's the case, I wonder if that's a better path today, either by withdrawing the A65 or by a no vote, which is where I am right now. Just a thought, Senator Draheim. Again, thank you, Senator Johnson Stewart. Thank you, Mr. Chair.
Senator Draheim.
Thank you, Chair and Senator Friends. It sounds like they already have the report. The report, and if we need to put language in this amendment to reference said report to make everybody feel good, I am fine with that. You know, I didn't think this would be an issue. That's why I always try to share my amendments. Everybody knows that. You know, the active oversight that was mentioned by the majority leader, you know, that is something that I've tried to improve on every bill that we see in every committee. That's easier said for the majority than the minority. And I think there's a lot of us at this table just want to do good legislation. And not all of us are political. A lot of us just try to make the best of whatever we're working on. The cost was brought up. If the report is already being done, I don't really see a cost. We just got done with Senator Mohamed's bill that we know there's going to be litigation on, and there was zero cost. And here we have a report that's already being done, required by federal law, that could be used to satisfy everything in this report at no cost, other than sending an employee for an hour or two a year to present to the committee. So I was surprised, I'm taken back a little bit by the pushback on this amendment today. You know, people in my district, and I believe across the state, as I travel across the state, want transparency. And this is a itty bitty step towards transparency. So I'm going to keep the amendment. I'm going to ask for a roll call on this amendment, because I do think this is a straightforward amendment. It's not a gotcha amendment. Should be very, 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 we're talking hundreds of dollars, not thousands of dollars to the people of Minnesota. So thank you.
Thank you, and I'll note that staff has sent out from the Attorney General's office a link to the reports that are required that compare all 50 states in terms of this. I haven't looked at those, so I don't know what they're like, but they have been sent out to all members on in the committee listserv. Senator Wickland on the A65 amendment.
Thank you, Mr. Chair. I guess I'm not seeing the value in this amendment. If the report is existing, if the link can be provided to the chairs, if they really, and the ranking members, if they really don't have a way to figure out, you know, where the report is located, I mean, that to me, you know, might be minimum step that could be helpful. But I think the last sentence about the office presenting the information in person before any legislative committee that requests this, to me, that's really unnecessary, because chairs have prerogative today to request people come and present information, and we all use that and collaborate with agencies and, you know, your office, Attorney General, and as well as, you know, any of the committee, or excuse me, the agency, you know, commissioners. So I really don't see any need for this, because this is part of our job is to, as we need it, as we need information, to request people to come and present it to us. Chairs have that ability today, so I don't see a need for the amendment.
Further discussion on A65. Senator Pratt.
Thank you, Mr. Chair, and members. You know, I don't know that I entirely agree with Senator Draheim's amendment to the amendment, but, you know, I'll take it as a compromise because we're appropriating the money on our fiscal year. We're supporting this effort on our fiscal year. And we need to be looking at our dollars that go into this and the effectiveness. I clicked on the link, and the last time that I see a report that was broken out by the state of Minnesota was issued 9/5 of 23. Otherwise, it looks like, and there's very few states that are broken out. I just see the Medicaid Fraud Control Unit's annual report, fiscal 2025, that was issued on 3/18/2026.
Mr. Wonka, on that.
I think the 9/5/23 report you're looking at is our comprehensive audit from HHS OIG. You may have been sent, I didn't send you the link. Okay, I'm happy to look at it. There is likely a separate link that lists a spreadsheet and a PDF every year by federal fiscal year. So there would be one for federal FY25 that captures every single state's statistics, and it's a Medicaid Fraud Control Unit report for everyone in the country, and then it's broken down by state and aggregated, you know, collectively for numbers, but you will also see the line item totals by state. It may just be in a different link on the HHS OIG website. I'm not sure exactly what you're looking at, but that's something that, like, when I'm done here, I can send it and we can make sure that you get the right thing.
We'll get the one that you send. I don't know where this one came from, but we sent it out to everyone, and it may be the improper link, so.
Mr. Chair.
Senator Johnson Stewart.
Thank you, Mr. Chair. I believe the Attorney General has a few things he wants to say.
Go ahead, Attorney General.
Thank you, Mr. Chair. I just wanted to note, again, I think the spirit of this proposal is certainly sound. I do think ultimately the practical reality is that it is duplicative for a number of reasons. One, the HHS report that Mr. Wonka was referring to, we will get you the right and proper link year by year. But we also issue a report called the 8.15 report, which talks about all the work of the Attorney General's office. And we also issue something called the false claims report in 16C. So those three reports that all bear on this issue. And then every single year that I've been the Attorney General, I come to Senate and House and make reports in the beginning of the session, and would be more than happy. But we will provide every link, and we will provide, and any time this committee wants me to show up, I certainly will make every effort to do it as long as this doesn't cause hardship to our office.
And Attorney General Ellison, yes, you have been very responsive whenever we've asked for information. Appreciate that. Is there further discussion on the A65 amendment with the oral changes incorporated in it? Senator Pratt.
Thank you, Mr. Chair, and members. I encourage a yes vote on the A65 amendment. You know, there seems to be a lot of confusion over, you know, where to find this report, where to find this link. The other thing that this does is it allows us as a legislature not to just rely on federal reports, which may or may not meet our needs, but to then go back and evaluate it and work on additional pieces of information that we need in order to do proper oversight, the proper oversight that our citizens expect us to do. Nobody ever expects a report to be kind of a one and done. I can tell you that from other committees, when I've seen these reports, the first iterations are usually not good. And so they evolve over time, and I think this is one that needs to evolve over time. But if we don't put that expectation in today, we will never move to that improved transparency. We'll never move to that improved accountability, and we'll never fully realize or take accountability for the oversight role that we have. So, Mr. Chair, I encourage a yes vote on the A65.
A roll call has been requested. Senator Johnson wanted to speak on this.
Thank you, Mr. Chair, and thank you, Senator, for bringing this forward. Appreciate the A65 amendment. So when we go back to our districts, one of the things that we constantly are asked is, what's going on with the fraud? What's happening right now? What is Minnesota doing to take care of the $9 billion of fraud that's gone out from our state? And we have to say, well, we think the Attorney General and his office is doing the work. We think that's what's happening. What this amendment is doing is it's saying it's getting the Attorney General to come out in front of our committees, in front of our leads, in front of our chairs, and saying exactly what's going on. This is not some sort of thing where we can send off a note to either our committees or to the feds and say, well, we've provided that information. Minnesotans want that now. They want it in front of them. They want us to have the ability to ask questions. There is no reason why we should not have full eyes on what's going on right now. What is our state doing to hold these people accountable? What's wrong with this amendment in holding people accountable to what's going on? We're going to provide money according to this bill to add more staff, to add more effort into the department, to the agency. And what you're saying is, trust us, we've got it in some paper that we'll send you a link later. To me, this is exactly what we need to do. Maybe it's got to be temporary. Right now, as we're going through this flux of time, when we don't know what's going on with fraud, with the prosecutions, what's wrong with having the Attorney General come in front and answer a few questions? To me, this makes complete sense, especially in the specific area that most Minnesotans are concerned about right now. So I'm going to be supporting the A65. This is a no-brainer, common sense amendment that's going to come forward. We're going to have a roll call on it, and we're going to see exactly what we need to do in this state and who stands behind the transparency of the Attorney General's office and what we're doing with fraud in this state. Thank you, Mr. Chair.
Mr. Chair.
Senator Johnson Stewart.
Thank you, Mr. Chair and members. I, too, am very concerned about fraud. I'm really pleased to be carrying this bill. Just Monday, I went to the city council of one of my communities that without doubt would vote solidly with Mr. Johnson's or Senator Johnson's constituents, and they asked me about fraud. I knew they were going to ask. It was a city council meeting. So I had done some research on this specific unit that has shown solidly that they are doing really good work to combat fraud, which is one of the reasons I'm so proud to be carrying this bill, is as I do my research, because this information is easily available to me, I can report the numbers. And it was a difficult meeting. There is a lot of accountability that our constituents are looking for. And with the numbers that I found easily through this Mafuku unit and through my relationship now with Mr. Wonka, it was very, I won't use the word easy because it's never easy to talk about those things, but I felt solidly equipped to talk about the good work that the Attorney General's office is doing, and I offered to come back. And, you know, I left that meeting with handshakes to all the council members. So this is one area that we can solidly quote the data we're given, and it just takes a little bit of work. I think this amendment is solid in its purpose, but the work is duplicative. You know, coming from private industry, every hour does take time, but it also takes money and resources. And so if this information is already available, if the reports are out there, which I found easily, I think that this puts somewhat of a duplicative burden on the Attorney General's office, and frankly, I'd rather them be investigating fraud. Although they're already doing the work, they're reporting the work. So I would encourage a no vote. I respectfully ask for your support on that in this roll call.
Staff will take the roll on Senator Pratt.
Thank you, Mr. Chair. Since the amendment's been amended, I was wondering if Senate Council could restate the amendment before we vote.
Please, Ms. Stengel, could you repeat the changes in the amendment?
Thank you, Mr. Chair. It's on the A65 amendment on page 1, line 9. After preceding, insert federal fiscal. So that phrase would say preceding federal fiscal year. And on page 1, line 11, after the word "the," insert "office of the," so that would say the Office of the Attorney General.
Senator Pratt.
Procedurally, are we voting on the amendment to the amendment, or are we voting on the amendment as orally amended?
I encourage Senator Draheim to incorporate those changes so we didn't have a separate vote on it, but if you want, we could, Senator Draheim indicated that was fine, and so we are voting on the A65 with the changes that were just described.
So, Mr. Chair, just for transparency, and sorry, Ms. Stengel, could you just read the amendment as we would be voting on it then, in its entirety?
Yes, thank you, Mr. Chair and Senator Pratt. The amendment would be Section 2, Statute 8.45, Annual Reporting to the Legislature. By January 15 of each year, the Attorney General shall report to the chairs and ranking minority members of the legislative committees having jurisdiction over the Attorney General and Medicaid fraud. The report must include detailed information on the Attorney General's Medicaid Fraud Control Unit, including the unit's budget and accounting for how the money was spent in the preceding federal fiscal year. The report must also provide information on the activities of the unit, including cases referred to it, investigations conducted, and the disposition of those cases. The Office of the Attorney General must present this information in person before any legislative committee that requests this.
Staff will take the roll.
Senator Marty?
Chair votes no.
Senator Friends?
No.
Senator Pratt?
Yes.
Senator Champion?
No.
Senator Draheim?
Yes.
Senator Howe?
Aye.
Senator Jasinski?
Aye.
Senator Johnson?
Aye.
Senator Mohamed?
No.
Senator Murphy?
No.
Senator Pappas?
No.
Senator Wickland?
There being 5 ayes and 7 nays, the motion does not prevail. And I want to thank, I think the Attorney General's office has done, and I think those reports, which we will probably wait till after the hearing to make sure we get the correct link out. I think those do show we've done good work, and the Attorney General's office has been vigorous in this, and I guess I like it that federal government's paying 3/4 of the cost of this. And one further thing that doesn't directly relate to this bill, but relates to Medicaid fraud, and later today we're taking up Senator Hoffman's Human Services bill, and he's got a number of provisions going after what I think is maybe white-collar fraud against Medicaid, where private equity firms are profit extracting from our nursing homes and everything else. And in terms of the total fraud against Medicaid, I think we're going to find out that that could top everything we've been seeing so far. And so I think Senator Hoffman and Senator Dibble and others have been working on that. And I just want to keep that in mind as we're talking about fraud in Medicaid, because just because somebody dresses for Wall Street and has a lot of money to invest in our nursing homes, and then they sell the properties to somebody else related to them, then the nursing home have to pay those higher rent charges and so on. That's ripping off our Medicaid system, and that kind of Medicaid fraud is killing people. And so Attorney General's office, you probably won't be here for that bill later today, but I think that I want to make sure we keep that in mind, because fraud against Medicaid is fraud, and it's outrageous, and I appreciate the good work you're doing on this, and I hope we as a legislature can enable more aggressive work on that as well. Is there further discussion on the A54 amendment? If not, Senator Friends.
Thanks, Mr. Chair. Just want to add these comments. Senator Johnson Stewart, thank you. We buried the lead here in our argument about reporting. What's going on, members of the Finance Committee, is that the federal government is going to contribute $3 for every one to help us fight fraud. Again, federal government contributing $3 for every one from the state to fight fraud. We are fighting fraud with your bill, Senator Johnson Stewart, and I want to thank you for putting it together. To the reporting issue, I would say I get the feeling that the information will be made available to any and all legislators that want it. So as we discuss this bill and the reporting requirements, please remember to mention to Minnesotans, this is a strong anti-fraud bill in which the federal government, who we send more of our tax dollars to than we get from, are going to help us fight fraud, and I think every Minnesotan will be glad to hear that, especially if the story is told properly. Thank you, Senator Johnson Stewart.
Senator Johnson Stewart, any final comments on your bill?
Thank you, Mr. Chair and members. No, as I said, I'm proud to carry this bill. It has been a lot of work, but along the way, we have accepted amendments from both parties. We've done a good job, the Attorney General specifically, of meeting with members of all parties to make sure the concerns have been heard. We want to equip the Medicaid Fraud Control Unit to continue to do the good work that they're doing. We want to optimize the federal money. We want to hear what the federal government is saying about the need to staff up to meet the need that Minnesota Medicaid Fraud Control Unit is addressing. And so I think this is a good bill. I'm proud to have carried it, and I ask for your yay vote.
And staff reminds me that we already voted on the A19 to put that into the bill. The final bill vote will be in the next few days. So, you mean A54, yes. I think you probably still need to vote. I thought we had, but we did vote on that. We did that. Okay. Yeah, that was my confusion about. I thought we had not. But we did. With that, Senator Johnson Stewart, yes, it looks you've been through several committees multiple times. And I appreciate your hard work on that. And with that, House File 2433 with the A54 added to it is laid on the table. And thank you for your time.
Thank you, Mr. Chair.
Thank you, Attorney General, Mr. Wong. As Senator Hoffman, I believe, is already here, but we are going to be handing out the packets now for the Human Services bill.
Thanks.
We are now going to hand out the packets for that. Thank you.
Do I have a minute?
While the bill is being distributed, perhaps we can have Ms. Stengel speak to the process we're expecting to follow on Senate File 4476, the Omnibus Human Services Bill.
Thank you, Mr. Chair and members. Senate File 4476 is the Omnibus Human Services Supplemental Appropriation Bill, and we will open with Senator Hoffman presenting his bill and Mr. Raymond doing a walkthrough of the spreadsheet, followed by any amendments and debate and discussion, and at the end of all of that, a motion to pass the bill out of committee.
With that, thank you, Ms. Stengel. Senator Hoffman, welcome to Senate Finance Committee on Senate File 4476.
Thank you, Mr. Chair, committee members. Before I begin, members, there's an A37 amendment I would like to have folks move.
Senator Hoffman has, Senator Wicklund will move the A37 amendment, which is in the packets as well.
Thank you, Mr. Chair.
Can you speak to that amendment, or?
We can. I mean, I will take the next 3 hours to explain what a pass-through is, if you'd like, Mr. Chair, or I could get Mr. Monahan to come up here and just highlight what it is that we are adding on the technical side for this bill. So if that's something you
Mr.
would like.
Monahan, you want to come very briefly? We do not want a half-hour explanation. Senator Hoffman might be happy. Senator Hoffman.
Yeah, Mr. Chair, and what you'll get out of this is the spreadsheet that y'all have in front of you reflects the A37 amendment. It's the clarification.
So then I'm going to suggest that after having called Mr. Monahan up, that maybe we adopt adopt this so we have the language in front of us that reflects the spreadsheet that we are going to be considering. Stay there, Mr. Monahan. We'll be using you later. With that, Senator Wicklund moves the A37 amendment to put it in the shape the author would like it to reflect the spreadsheet.
Thank you, Mr. Chair and members. This is our Omnibus Human Services budget bill. I'm going to mention a few of the key provisions in the bill before Mr. Raymond and Mr. Monahan talk us through more in detail. And so, but the clearest and most important priority for Minnesotans in our little jurisdiction this year that we heard is the need to secure continuity of care for people who rely on services. And that term continuity care is actually prevailing language used across in Centers for Medicaid Services and specifically on people that we have with disabilities in our wonderful state. Some of the key provisions of the bill I want to highlight to you, Mr. Chair and members, is that establishes that continuity of care team at the Department of Human Services. And that language ensures that the continuity of care plan is ready for each individual whose services are disrupted by a payment withhold. Speaking of disruptive services, Lydia is here, and I know we don't take testimony from the public, but Lydia helped write another amendment that we're going to be adding on later that we're going to talk about, specifically when it comes to guarantee that continuity care. Senator, Mr. Chair, and you and I have talked briefly about that. We can talk some more. But what is also needed is a greater transparency requirements when a for-profit entity purchases a nonprofit long-term care facility. And when you're looking at that as assisted living facility or any kind of, congregate setting other than nursing homes. Nursing homes, of course, are entitlements. The other ones are, you're looking at assisted living in that. That protects the well-being of loved ones in long-term care by requiring appropriate nursing staffing. We look at, this looks at long-term care residents and their families, affording the care part, protecting against unreasonable fee increases that exceed the cost of CPI inflation. Senator Erin May Quaid is going to be here later on. She's someplace else, but she can sure talk about specifically the CPI conversation that Senator Mann talks about within this bill. Well, the other thing, Mr. Chair, is we create a Min Choices assessor team at the department to help counties process assessment backlogs more quickly. There's a huge gap there. We also, when you look at the Family Residential Services framework rates, which I want to be very clear, Mr. Chair, we have we moved from a DWRS system, or this is the conversation, to a tiered system. There is some debate within that tiered system on whether or not that is something that is affordable, A. B, also, are we leaving people behind? If Dr. Senator Liskey is correct, he brought some assumptions up that we're having the department look at. If things are correct in what Dr. Liskey is saying, Mr. Chair, this changes our whole dynamic, and I'll be back in front of you with a whole different approach as far as what we're doing. But right now, until I get clarification from the department on whether or not there are some gaps within the family foster care mold, then we'll just keep going with what we have in front of us. I hope I'm making sense. That is, but regardless, we are increasing the Family Residential Services framework rates for service recipients with high needs. That's another tier we're adding to that. We're going to repeal the Waiver Reimagine plan because the process of developing it has not been inclusive or transparent for individuals and families, Mr. Chair. That actually has been in the works for many, many years. The previous chair of this committee, when we were in the minority, was dealing with the same issue that we are dealing with now. It just seems to follow us along. Finally, this bill takes a substantial step to buy down the $178 million assumed savings cut to human services in fiscal year 28-29. If the legislature doesn't act, this cut will be passed along with the competitive workforce factor in DWRS rates and the county cost shares in residential services. We don't want that to happen. This budget buys down that cut completely in fiscal year 28 and buys down a portion of it in its tails. That's good progress, and that's also saving to the counties and to the individual DWRS providers. What is not included are the provisionals about program integrity. Program integrity is a separate bill, Mr. Chair. We're working on that, and it's a comprehensive program that's an integrated package, and we are doing that jointly with Senator Wickland and her committee that we expect to be heard in our committees next week. She's shaking her head yes. And so I want to be very clear. It's a bipartisan priority for members of both the Human Services and the Health and Human Services committees, and its best and most collaborative way to address this issue is through a separate bill, and that's what we're doing, Mr. Chair. So, Mr. Chair, with that, we could either go to Mr. Monahan or Mr. Raymond, or we can have the discussion on the A25 amendment, Mr. Chair.
Senator Hoffman, we have not yet. Senator Wickland moved the A37 to put it in the shape with the, reflect your presentation and so on. So on Senator Wickland's motion that we adopt the A37 amendment, all those in favor say aye. 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 Opposed? Motion prevails. Now the bill is in the shape that Mr. Raymond or Mr. Monahan can begin going through.
Thank you, Mr. Chair, members. For the record, I'm Kyle Raymond, Fiscal Analyst of the Human Services Committee. So today I'll be walking through the Human Services Supplemental Budget spreadsheet. I'll just point out in the bottom right-hand corner, it has a date timestamp of April 28th at 6:40 p.m. So that corresponds to the lines and pages that I'll be referencing. So to start, the first kind of half of the first page just contains some summary information about both the base funding and also for the committee, and also the changes that the bill makes. The governor's position is represented in the center set of columns, and the right-hand set of columns, as was already discussed, reflects the A38 that was just adopted. So to start, I'll start on line 11. So this shows the total net fiscal impact of the bill. And if you look in the fiscal year 26-27 biennium, it reduces net expenditures by about $55.3 million in the 26-27 biennium, and then the fiscal year 28-29 biennium, it's an increase of expenditures of about $192.3 million. Lines 49 through 102 show a by agency breakdown. I'll note that there are only general fund appropriations changes contained in the bill. Now I'll move to the specific proposals. In general, I usually skip over if there are governor's proposals that are excluded from the bill. If there is a hashtag symbol, that means it's a budget neutral provision or proposal. And I'll start with DHS on line 146. So this is a proposal to establish a continuity of care team. This has a cost of just over $4.5 million in the 26-27 biennium and just under $11.4 million in fiscal year 28-29. Moving next to line 155. This is a governor's proposal, and also there was a Senate file related to this that modifies the nursing facility level of care eligibility for both CADI and BI. So this reduces future expected expenditures in the first biennium by just over $2.6 million, and is an expected reduction of about $42.7 million in the tails. So I'll now move to page 2. The next proposal included is on line 165. This is a governor's proposal that would allow for a waiver for the state medical review team medical records fees. And this is a budget neutral proposal. Moving next to line 167. This is from Senate File 4279. I also list there Senate File 476, the A21, so that is what the fiscal note was requested to. That reflects these numbers, but this proposal enhances home and community-based setting co-location prohibitions for certain licensed residential programs, also referred to as congregate care. So this is the DHS portion of this. There's also an MDH cost, which I'll cover later on. The cost to DHS is just over $1.2 million in the fiscal year 26-27 biennium, and just over $2.1 million in the tails. Moving next to line 177, so this is a requirement for DHS to post interpretive guidelines for disability waiver regulations. This has a cost of $300,000 in the 26-27 biennium, and then $704,000 in the 28-29 biennium. So move next to line 182. So this is from Senate File 3928. Relating to CFSS shared service requirements. So for this one, I'll just note that this was in the Human Services Policy Bill. It was flagged as having a cost, so then it was put in the budget bill. And the proposal is funded at the amount included in the fiscal note of $399,000 in the 26-27 biennium and $936,000 in the tails. Moving next to line 187, so this is a governor's proposal related to transforming the human services system, Min Choices, creating the Min Choices assessment team, redesign work group, as well as a study. So this has a cost of just over $2.5 million in the first biennium and just over $13.1 million in the tails. I'll note the governor's position for this proposal is included in Senator Wickland's budget. This was a proposal that contained multiple provisions that related to both HHS and HS. So I'll just note that this is funded at the governor's level. So moving next to line 206, this proposal would repeal waiver reimagine. This has a fiscal effect of just over $2 million in the first biennium and just over $50.6 million in the tails. So now I'll move to page 3, line 212. So this would reduce the long-term services and supports assumes spending reductions. The total enacted last session for the 28-29 biennium was about $178 million. So this essentially buys back about $113.7 million. Moving next to line 217. So this is a waiver case management work group and rate study from Senate File 4395, and this has a cost of $374,000 in the first biennium and $510,000 in the tails. Moving next to line 223. This is, it has an rate increase for family residential services with high needs, the high needs portion of family residential services. So this would have a cost of $189,000 in the first biennium and just over $5.6 million in the tails. Moving next to line 227. So this is a budget neutral proposal related to disability waiver, annual vehicle and home limit modifications. Moving next to line 229, this is from Senate File 3758 and would repeal the disproportionate share facility rate floor sunset. So essentially it would, the program is set to end at the end of fiscal year 2028, and this would remove ending the program. So this has a fiscal effect in fiscal year 29 only the cost would be ongoing, but it only represented on the spreadsheet of about just over 2.3 million in the tails. Moving next to line 243. So this is a governor's proposal related to federal compliance with the Medicaid access rule. This is included at the governor's amount of 1.4 million in the first biennium and just over 2.2 million in the tails. And then now, actually we'll skip to page 8. Between pages 3 and page 8 are a number of governor's proposals that are not included. So the next proposal that is included is on page 8, line 401. This is a part of their the governor's budget and technical changes that would direct payment for tribal substance use disorder prevention funds, and this is a budget neutral provision. Line 403, this is a part of the same governor's proposal and would direct payment for tribal administrative allocation. This is budget neutral as well. Moving next to line 405, this is a governor's proposal that would create an earlier effective date for improving supportive housing options. This was enacted last year and had a delayed implementation, and this would move the effective date up. So this would reduce expected future expenditures by just under 9.2 million in the 26-27 biennium and about 1.78 million in the tails. Moving next to line 410, this relates to the governor's budget and technical proposal to make a change to the correction to the substance use disorder model rate statutes, and this is a budget neutral provision. Moving next to line 412, this is also a part of the governor's budget and technical proposals, and it would expand the eligible uses for withdrawal management, startup, and capacity building grants. Moving next to line 417, this is a governor's proposal that relates to federal compliance related to access to services for incarcerated individuals and would have a cost of $178,000 in the first biennium and just over $3 million in the tails. Moving next to line 427, this is another governor's proposal that would allow carryover of gambling treatment funding from the lottery fund, and this is a budget neutral proposal. Moving next to line 429, this is from Senate File 2972 relating to for-profit acquisitions of certain nonprofit long-term care facility regulations. In addition, there's also staffing requirements in the bill. So this is the DHS portion. There's also Department of Health and Attorneys General costs later on in the bill. But the cost to DHS related to this proposal is $100,000 in the 26-27 biennium and just over $1.2 million in the tails. Moving next to page 9, line 436. This is from Senate File 3844. So similar to what I mentioned before. So this proposal has a DHS portion, and also there's a cost to MDH as well that I'll cover later. The cost to the Department of Human Services related to automatic external defibrillator and also additional requirements for nursing facilities would cost $304,000 in the tails. Moving next to line 441, so this would delay the NEMT single administrator until implemented, and this is a budget neutral proposal. Moving next to line 443, this is a governor's proposal to provide additional funding for the Human Services Response Contingency Account, as it is included at the governor's level of $10 million one time in fiscal year 26-27. Moving next to line 449, this is a governor's proposal that would reduce multiple human services grants, including the long-term services and supports loan program. So the net effect of the proposal is a reduction of about $73.7 million in the first biennium and just over $5.7 million in the tails. Moving next to line 460, so this extends the Direct Care Services Corps pilot project, and it extends a report as well as the appropriation, and is a cost neutral proposal. Moving next to line 465, this is from Senate File 2853, and will provide funding for this, the supported decision-making programs, and that has a cost of $2 million in the 26-27 biennium and is one time. Moving next to page 10, the next proposal included is on line 471. So this will repurpose an intensive residential treatment services grant for Brooklyn Park's community health unit. So this was, the grant was going to Brooklyn Park's IRTS, and is instead being repurposed to go to their community health unit, and is a zero cost proposal. Moving next to line 476, so this is a peer recovery support grant for Todd County, and this has a cost of $300,000 in the first biennium and then $600,000 ongoing. Moving next to line 480, this is from Senate File 4709, and funds a pilot program for Thrive Family Recovery Resources, and is a one-time cost of $350,000 in the 26-27 biennium. Line 484 is a governor's proposal and was also in Senate File 3967, and would extend the pediatric to home pilot program report, which also requires extending the appropriation, and is a zero cost proposal. So now moving to direct care and treatment, the first proposal included is on line 591. This is a governor's proposal that provides authority for DCT to accept gifts for patients. Lines 593 is a governor's proposal from DCT that exempts DCT facilities from security X-ray machine requirements, and is a zero cost proposal. Moving next to line 595, this is a governor's proposal and was also in Senate File 4047 that would extend an appropriation for the County Correctional Facility Pilot Program, and is also a zero cost proposal. Moving next to the Department of Health, line 635, so this is a governor's proposal that would allow an extension for the Home and Community-Based Service Employee Scholarship and Loan Forgiveness Fund, and this is a zero-cost proposal. Moving next to line 637, this was one of the Senate files I mentioned earlier, Senate File 2972, relating to for-profit acquisitions of certain nonprofit long-term care facilities, as well as including staffing requirements. The cost to MDH is $475,000 in the first biennium and just over $26.8 million in the tails. Moving now to page 11. Line 643, this is from Senate File 3733 and would modify the use of fines collected related to home care licensing and survey and investigations, and is a cost-neutral proposal. Moving next to line 643, so this was an amendment adopted in Human Services relating to, it was the A10 amendment, and there's a fiscal note to this proposal related to federally qualified health clinic exemptions from or exempting federally qualified healthcare clinics from the home care licensure requirements, and this is a budget neutral proposal. Moving next to line 645, this is from Senate File 3844. This is one I mentioned earlier and had a cost to DHS and relates to assisted living facility cost increase review and nursing facility and assisted living facility regulation. The costs associated with this proposal is just over $2.5 million in the 26-27 biennium and $5 million in the 28-29 biennium. Moving next to line 649, this is again from Senate File 4279 that I mentioned earlier. This is the congregate care proposal and has a cost to MDH of $655,000 in the first biennium and just over $1.2 million in the tails. Moving next to line 653, so this relates to Senate File 4121. Also note here, this was one that was in the policy bill but was flagged as having a cost, so the costs were brought over to the budget bill. This relates to assisted living facility medical emergency requirements, trainings, and a fine violation increase, and this has a cost of $312,000 in the first biennium and $624,000 in the tails. Moving next to line 657, this is a proposal to create a small assisted living facility licensure group that would produce draft legislation related to establishing small assisted living facility licensure, and has a cost of $150,000 in the 26-27 biennium and is one time. Moving next to line 661, so this is a governor's proposal to correct substance use disorder administrative language and does not have a fiscal effect. Moving now to the last two, there is a cost to the Attorney General on line 782 related to Senate File 2972. This was the one I mentioned a couple times related to for-profit acquisitions of nonprofit long-term care facilities. And this has a cost of $112,000 in the first biennium and $224,000 in the tails. And finally, line 788 is from Senate File 4211, and this would allow authority for the Board of Executives for Long-Term Services and Supports to modify in statute their maximum fees. There is a fiscal note on this, and it has zero. It's budget neutral provision. And with that, Mr. Chair, that concludes my remarks.
Thank you, Mr. Raymond. Lengthy sheet, you may be out of breath. Before we address questions on that, Senator Hoffman had asked if we could take a sidestep before we have to recess soon for session and so on, but wanted to raise an issue, Senator Hoffman, the A25 that we had discussed. Do you want to raise the issue?
Yeah, I do, Mr. Chair. You and I had talked. One of the compelling realities this year, when we talk about continuity of care, there's an individual, and she's here in this room. I know we don't take public testimony, but Lydia is right behind me. Actually met with a couple of senators, a bunch of senators, and talked about what had happened to her in this payment withhold that the governor decided, to do, right? It wasn't well thought out because of the fact people like Lydia were denied services, said she was no longer eligible for services, and was without services, Senator Marty, for a long time, months. Thank God her mom was able to forego her day job and actually go spend time with her daughter like any parent would do. But that led me to this conversation, the what if piece. Somebody who needs services in the state of Minnesota, and Lydia expressed this with Alma and expressed it well, and we took notice. But if there's a what if factor where all of a sudden there isn't payment coming from a source, and Mr. Raymond is amazing, by the way, Eric, you need to know that. He gets it. And explains it well. And yes, we all were taking breaths because he was just going through it. But that's the back scene, what's happening, right? But the front scene is really, what does that dollar amount mean to people who need the services? In this case, Lydia wasn't given the services that she signed up for. Not okay. So the what if factor, if this happens in the future, what can we do to assure that Lydia and people like Lydia that were denied services, no fault on her own, Senator Frentz, right? None. So that's what led to this discussion about, well, if we, the most vulnerable in the state of Minnesota, are elderly and people with disabilities, if we're able to offset that through the reserve, so it's basically, Senator Marty, it's not a forecast grab. I'm not doing that at all, Mr. Nauman, just to let you know. But this really gets a what if. What if this happens in the future again? I want to make sure continuity of care, which is a requirement under the federal law, isn't taken care of. And that's where this conversation leads to. The reserve, extract, it's a balance sheet discussion. And that's where that comes from, Senator Marty. It really is it's a what if.
And thank you, Sir Hoffman. And I think, I share the concerns, what happens with people who are vulnerable when things happen. And I had been working, we've talked about this before, I had distributed the A25 amendment, which, because I want to make sure we have a discussion of this and whether it's something we adopt. If we do it, probably more appropriate in the Omnibus supplemental bill. But
sure.
But the first part of the amendment is one that recognizes that, you know, if we face some significant cuts, unexpected cuts from the federal government, and it happens in the coming months, rather than call a special session, rather than unallot, rather than everything else, that this would enable MMB to tap into the, would be able to tap into the budget reserve, which would be refilled then at the next forecast time. But if there's deep things, which I think what I'd like to say is I hope this never would happen. But if so, that was the provision I had been talking about with you, and then you also added the part that would be section 5 of this amendment. And I wonder if you want to speak to that very briefly. I'm not offering the amendment now because I think it's something I want to hear from committee members and others to so on. But just to, because I think this is a very important thing, that we don't leave people high and dry as federal government or whatever is making changes that hurt the people that we've got a legal and a moral obligation to take care of. Senator Hoffman, go ahead.
Thank you, Mr. Chair. And we had, in your version of the A25, there was the larger one, which we shrunk down to 2 paragraphs. The notwithstanding piece really is the exception under fiscal years 26 and 27. The language that is in there should be self-explanatory, Senator Marty. And really what we're trying to say there is this defines the commissioner where they may not reduce the allotments or defer the suspended statutorily created obligations for MA on the long-term care or medical assistance, long-term care and supports. And it defines what those are in there. So it's very clear that it's just those folks and the individuals that have the most need are protected. Because in this case, if it wasn't for Lydia's mom, Lydia wouldn't be protected. I don't even want to know or think about what the outcome could have been, right? I don't ever want to do that. Because unless you face death, Senator Marty, you really got nothing to say on this. So it's really that piece of it. So, but this gives clear delineation to what the commissioner can and cannot do. And that's what we as legislators need to be able to do, right? Is to drive that conversation.
And I would like to have Mr. Nauman explain how the interactions of the budget reserve and
So, Mr. Chair and members, I'd be happy to do that. Sections 4 and 5 on the A25 amendment deal with two interlinked but separate conditions in permanent statute. Section 5 establishes a slightly different circumstance under which the Commissioner of Management and Budget would have authority in the absence of the legislature taking action on its own to move money from the budget reserve into the unrestricted general fund to balance the general fund if the budget fell out of balance. And the extra condition, it's probably worth having me explain first that under current law, the statutory authority given to the Commissioner of Management and Budget is if the revenues are reduced or lower than anticipated and the amount for the remainder of the budget is less than needed. In other words, the budgetary balance is not sufficient to cover that revenue loss. So the statute contemplates that the forecasting process didn't pick up a slip in revenues, that then the commissioner has authority to use the budget reserve to balance the overall budget. What's different in this circumstance, or what the amendment contemplates, is that it could be revenues, but it also could be an increase in spending that is potentially driven by a loss of federal funds. And that is particularly relevant in the Health and Human Services space, where the legislature appropriates state money that assumes some amount of federal funds. Federal funds are in a separate fund and they're not counted as revenue in the general fund, but there is a deep interaction between the federal funds and the spending in the general fund. So if the federal funding went down, then the general fund spending could go up, and that could inadvertently throw the budget out of balance. And what Section 4 does is contemplate that possibility and provide the Commissioner of Management and Budget with authority that doesn't, in my view, exist in law to balance the overall budget if using the budget reserve if the spending increases and not just if the revenues go down. I'll pause there, make sure that everyone's tracking with me on that. Section 5 is different. Section 5 deals with the unallotment statute, which is just the next paragraph in the same order of statute. Under current law, if the budget reserve is insufficient to return the general fund to balance, then the governor and the Commissioner of Management and Budget have authority to reduce what's called an allotment, or basically spending authority, to bring the budget back into balance. And what Senator Hoffman and Senator Marty have asked the committee to think about is whether or not it's appropriate to adjust in fiscal year 26 and 27, essentially obligations for long-term services and supports, or long-term care, for nursing facilities, intermediate care facilities, and other long-term institutional settings, as well as long-term services and supports for alternative care, home care, community first services and supports, and some specific services labeled in the statute. This is Mr. Monahan's expertise. The idea here with the amendment is that that would remove these specific items as items that could be unallotted if unallotment were deemed necessary. So these two sections work together, but they are also distinct.
And Senator Draheim.
God, he's good.
Thank you, Chair. And the concept, I understand. I get why you're concerned and how important the programs are. I do understand that. But my question is, what are we looking at per month? If worst case scenario, something happens, you know, I mean, looking at our reserves and, you know, how many months can you spend money, Senator Hoffman? And I just, food for thought, hopefully we never have to deal with it, but I just was curious, how much are we thinking per month?
Senator Draheim, I think it would depend on how much the cuts were and everything else. The point of the budget reserve is to deal with crises, and this would allow the governor to do that before making certain other changes or before calling the legislature back in, because I think if something drastic would happen, it would have to be very continued, more significant federal withholds or whatever. But anyway, I guess what I'd like to do is suggest that, because I think we're going to have to recess, I'd like to continue this conversation, but basically we'll give you a chance yet.
Yeah.
I think this is something I hope we can, as a committee, I want to hear feedback. I'm sure we may hear it from MMB and others as well. I guess I want to hear that, and we can discuss this before we finish the supplemental bill on Friday. But Senator Hoffman, I'd like it if you could comment briefly before we recess.
And to Senator Draheim, Mr. Chair, Senator Draheim, absolutely, it should be minimal. I'll get those numbers on the break. I'll get you the actual, what we think that number would be. And I appreciate the question, and I appreciate the conversation, Senator Marty. This is something that fits our theme of continuity of care. This is the bottom line of what Human Services and why we do what we do in Human Services. That's it. So thank you. Go to your break, I think.
Sure, but Mr. Nalman, do you have one quick comment for Senator Draheim response to that?
Mr. Chair, Senator Draheim, not precisely to your question, but Pew Research does an analysis of rainy day funds by the states, and their most recent analysis was just published maybe a month ago. And for Minnesota, they estimate that Minnesota, if you had no revenues at all, could operate on its budget reserves for about 36.3 days, which is middle of the road relative to other states. Obviously, that's not exactly the question you were asking. The budget reserve's right about $3.5 billion now.
With that, we will way over Senate File 4476 until after session. And committee members, we are planning to return to room 1200 here, so you may leave your packets on the desk and everything. But we will come back, I'm guessing, 30 minutes after adjournment. With that, this meeting is in recess.